Initially, it was looking very localized to China with a few outcroppings here and there elsewhere in Asia. But this last week has really changed the picture. We now have community spread in South Korea. We have what looks like an outbreak coming out of Italy without any clear link back to the epicenter in China. We're now seeing cases in the United States without any clear epidemiologic link to the epicenter in China. All of these things are suggesting that this virus is far more transmissible than we thought before, and the likelihood of a global pandemic has really increased dramatically. These preparedness efforts have been going on for well over a month, and not just here at Mayo Clinic, but also elsewhere in the country, to really prepare ourselves to take care of our patients, maintain our staff safety, but also maintaining the health of the population. Right now, all testing for COVID-19 needs to be done through public health laboratories. Most of this has been done through CDC. But with the pandemic potentially looming, CDC has recognized the need to expand its testing capacity and looking to other public health laboratories, potentially either other laboratories across the country, to help expand the availability of testing for COVID-19. As time has gone on, we've realized it's far more transmissible than we previously thought, but also less pathogenic. It causes less severe disease than we initially thought. In fact, most people who come down with COVID-19 who are previously healthy have mild symptoms. And so the way to look at this is much more similar to influenza. And if you feel as though you have influenza, if you are otherwise healthy and are doing relatively well, it's best to do social distancing, stay at home, drink plenty of fluid, get plenty of rest. If you have medical comorbidities or are experiencing more severe symptoms, that'd be the time to contact your healthcare provider because more supportive care, these sort of things may be needed, potentially even hospitalization. COVID-19 largely causes pneumonia, infection of the lung. Depending how severe that is, that can then extend to causing multi-organ disease and affect other systems, but primarily this is an infection of the lung. I think for the general public, it's best to look at this in the same way that they would look at something like influenza, in that if they are sick with a fever and a respiratory illness, they should stay home, not go to work, not go to school. Of course, if they are having severe symptoms or have medical comorbidities that put them at risk of severe illness, they should certainly seek health care, talk to their healthcare provider to see if further care is needed. But in general, people who are developing fever and respiratory symptoms, who are otherwise doing relatively well, they can stay at home, make sure they are washing their hands, having good respiratory etiquette, sneezing into the crook of their elbow instead of onto their hands or into the general public. But this is the general approach, similar to what people do for influenza. Take care of yourself, cough or sneeze in the crook of your arm, and wash your hands.